So last class, I talked about hypersensitivity reactions. And the last one that I was talking about was asthma. Asthma, as you all can see, is the most common chronic illness in children. There are a couple of different types of asthma. You have your allergic asthma, which means that your body responds to something outside of yourself that is extrinsic. This one is the most common form, as it says. So what happens, like I mentioned, you have the external allergens, the things that the person is allergic to in the environment, they inhale it, and it starts to trigger reactions in their body. So some of their plasma cells start to secrete parts of the immune system. It's IgE, immunoglobulin E. If you remember back when we were talking about blood, we talked about blood proteins. Please go back and look at that just so that you can see the correlation. One of the types of proteins that your body makes is immunoglobulins. These immunoglobulins are parts of your immune system that help your immune system do different things. In this particular case, the plasma cells secrete IgE. So what happens in this case is that the IgE binds to most of the cells in the respiratory tract, more specifically, the respiratory mucosa. And mucosa is the type of skin, it's like skin that is on the inside that lines the organ that helps to protect it. It is usually covered with mucus, hence the name mucosa, so that it's, again, protected by bacteria, virus, fungi, dust, whatever is in the air. When your body inhales or when your body ingests something, the mucosa will try to trap it to help get rid of it. When these things happen, your mast cells release a bunch of inflammatory type chemicals. This is what causes the airways to become inflamed. And this is when that inflammation happens, it starts to close off the airways so that you can't get as much air into the lungs. The non-allergic asthma is caused more intrinsically, and it can be triggered by things that are already inside. So if you already have an infection inside, if you're taking certain medications, cold air, high emotions, these things can trigger asthma attacks. This is the kind that's more common in adults. But the way the body responds, the asthmatic symptoms are the same for both your extrinsic and intrinsic types of asthma. So again, as I mentioned, when you have asthma, you have bronchospasms. Spasms are when your muscles start to tighten uncontrollably, and it happens in your bronchioles, which are your air tubes. That happens within minutes. The person is coughing, trying to basically open up the airway so they can get more air. Wheezing occurs. Wheezing is what happens when your air the air you inhale tries to go from the outside to inside your lungs, but it's going past a narrow airway. And so then you hear that sort of whistling sound. That's what wheezing is caused. And again, sometimes it can be fatal in that the person could suffocate because they're not getting enough air. Once a person gets over an asthma attack, it's possible to have a respiratory crisis several hours later. It doesn't always happen, but keep it in mind that it could happen when someone has an asthma attack. Interleukins, which are chemicals that your body produces, will attract eosinophils, and you already know what eosinophils are. So make sure that if you've forgotten which type of white blood cells eosinophils are, go back and look at that. The eosinophils are attracted to the bronchial tissue. Those will secrete proteins that will paralyze respiratory cilia. So cilia are like the finger-like projections that come off the ends of cells. And if you go back to the very first lesson that you learned in anatomy, when we talked about different types of tissues, you remember there were cells that had these little hair-like projections from them. The hair-like projections will help to move mucus. out of the body. It helps to move things along the tract, whether you're in the respiratory tract or in the digestive tract. That's what cilia does. So these proteins that are secreted will paralyze the cilia so that the cilia can't brush anything or help move anything along, which means it just sits there. So if the person has increased amounts of mucus that is trying to protect them and trap the dust or trap the bacteria, trap the virus that they're inhaling, the mucus will continue to increase to help get rid of it. Cilia is supposed to help move that away, but it's paralyzed, so it can't do that. It can't do its job. So this will damage. You can get severe damage from an asthma attack from these bronchospasms. This could possibly lead to scarring. And if there is scarring, if there's enough scarring, then it can do damage to the lungs. So just think about how scar tissue on your arm, on your leg, is different from the rest of the tissue around it. And that's basically what could potentially happen in the lungs. Bronchioles can also become edematous. Edematous basically means that it is has a lot of edema, and edema is when you have fluid buildup. So remember, we talked about the fluid that leaves the cardiovascular system and goes into the interstitial tissue, interstitial spaces, but the lymphatic system will typically move it out. So either the lymphatic system or the cardiovascular system will take that fluid and take it back into their vessels so that the fluid can go back into circulation and be recycled. But in these cases, edema is when that fluid is not taken back up for whatever reason. So the bronchioles become, the tissue itself becomes engorged in fluid. And you also have this big, thick, sticky mucus. And all of that together, along with the constriction of the bronchioles, makes it much harder for the person to breathe. And this is why asthma could potentially be fatal. So again, the treatment for asthma, you have epinephrine, which is that adrenaline type chemical that your body produces. There's also the beta adrenergic stimulants. So these are stimulants that will look for specific receptors in the body, the beta adrenergic receptors. Both epinephrine and these stimulants will help to dilate or open up the airways to help the breathing become more restored. The person can also use corticosteroids if they have asthma attacks that occur often enough. If they have asthma attacks that are severe enough, they could be prescribed corticosteroids to help dampen or decrease the action of their immune system so that can help decrease and minimize the inflammation, which can decrease and minimize long-term damage. So now let's talk about autoimmune diseases. Autoimmune diseases occur when your body doesn't recognize your own tissues as itself and starts to attack it. Remember, auto means self. So that's what it means when it says that it is a failure of self-tolerance. Your body, when you're very young, your body will produce antibodies to almost any and everything, but then your immune system will go through it and see which ones look like itself and which ones do not. In a healthy body, your immune system will take the antibodies that are against anything in the body and remove it so that it's not produced anymore, so that your body is not attacking itself. But when that fails to happen, then you have these white blood cells that produce antibodies that will attack its own self. It cannot distinguish itself from foreign antigens. There are several reasons why your body will start to attack itself that will, that it's not tolerant of itself anymore. You have cross-reactivity, which we'll talk about. you have abnormal exposure to self-antigens, and you have changes in self-antigens. So cross-reactivity basically means that you have some antigen, some foreign antigen that gets into the body and your body starts to attack it. The unfortunate thing is sometimes those antigens look very similar to antigens that are already in your body. So as your immune system is fighting that thing that is actually foreign, as it's once it clears that out and it starts to look for other things, remember your immune system goes on patrol in your bloodstream. As it continues to do that, then it sees something that looks very similar to the antigen that it just fought. And unfortunately, that is your cells. So your body starts to attack your own cells because they look very much like the foreign invader that it was fighting earlier. So the example here is rheumatic fever. You have streptococcus is a type of bacteria. Antibodies to streptococcus can potentially react to the valves of your heart. So your AV valves and the other valves, and your pulmonary valves, etc., could be attacked because antibodies that attack and get rid of streptococcus might see your heart valves as a foreign invader and attack those. If you have abnormal exposure to your own antigens in your blood. So some things in your body, they're not supposed to be exposed to blood. This is why you have, like everything is very compartmentalized and it goes only where it's supposed to go. But if for whatever reason, some of these antigens that are supposed to be in one place in your body gets into your bloodstream, then your white blood cells could see it as foreign because it's not something that it normally sees. For example, if you have, men, those who have testes, have a certain thing called a blood-testes barrier. This is a barrier that encloses the testes so that what the testes produce don't get into the bloodstream, i.e. sperm won't get into the bloodstream. So if for whatever reason this barrier breaks down and sperm does get into the bloodstream, then your body will start to see it as foreign, form antibodies against it, and then those antibodies sperm is then started to see, sorry about that, your body starts to see the sperm as a foreign antigen and then will try to destroy it. So this is one example of abnormal exposure to self-antigens in the blood. Then you have changes in the structure of self-antigens. So if you are invaded by viruses, sometimes if you take certain medications, I don't know which medications it is, I just know that it occurs, there may be a change in the structure of your own antigens. And because your own antigens change structure, change shape, then they could change in such a way that certain antibodies will recognize them as foreign, and then the immune system will start to attack them. Self-reactive T cells. So again, when you're very young and your body is producing all the white blood cells that it could produce to all the things, so that when you're exposed to things, it's already prepared. And as I mentioned, your body will go through and say, this one looks like itself, this one looks like me, let me take it out, so that it's not it doesn't react negatively toward yourself anymore. Sometimes those self cells are not eliminated. And if they're not eliminated, then they are not allowed, but they will get into circulation and start to attack itself. Remember I told you about the thymus? The thymus is that gland that that continues to grow up until sometime around 20, 21 or so years old. And then the thymus starts to decline in size. And as you get older, it's almost not there. But it's the thymus's job to actually take those white blood cells and remove them from circulation so that they don't attack self. And occasionally, they won't be able to catch the white blood cells, the T cells specifically, and you might have an autoimmune disease that occurs. So this is a picture of what used to be called, and some may still call, a boy in a bubble, or a bubble boy. This kid has an immunodeficiency disease. So his immune system is not reacting strong enough to bacteria or viruses. He has a deficiency in his immune system, which is what immunodeficiency means. So in these particular cases, because his immune system does not react strongly enough to any kind of foreign antigen, and it does not get rid of it, then the body, then the child is always sick and could potentially die, because they're more vulnerable to opportunistic infections, meaning bacteria. Remember, we said that we have way more bacteria cells inside of us than we have our own cells. Some of those bacteria cells are what's called opportunistic, meaning that the only reason they don't cause disease is because they haven't had the opportunity. Once they get the opportunity to do so, then they will take that opportunity and they will grow, thrive, and just wreak havoc on the body. So this child lives in a bubble. Basically, that's why they had to give him a NASA suit to make it look kind of cool, but they put him in the protective clothing so that he's less exposed to bacteria, viruses, and any other thing that could cause his immune system problems. This particular disease is called severe combined immunodeficiency disease. Severe combined immunodeficiency disease. So the immunodeficiency disease that we all know of the most is AIDS, acquired immunodeficiency syndrome. So AIDS is the disease itself. It is not hereditary. This is something that people are usually develop after birth, especially like if a parent or mother has it, they can get it when they go through the birth canal. Because remember, prior to that, the blood does not mix, but because the birthing process can be so traumatic on bodies, this is where this baby could be exposed to the virus that causes AIDS. When a person is infected with this virus, you have your immune system that becomes extremely depressed, meaning the response to foreign antigens or to problems is very, very decreased, because the immune system is not strong enough anymore to give a response. The virus itself is called human immunodeficiency virus, or HIV. So HIV is the virus. The disease is called AIDS. It's kind of like the SARS-CoV-2 is the name of the virus. COVID-19 is the name of the disease. So remember the difference between AIDS and HIV. One is the virus, one is the actual disease that the virus can cause. This virus invades your T cells, your macrophages, dendritic cells, and they trick them into internalizing the virus by endocytosis. Remember, these cells, macrophages in particular, are the ones that phagocytize or eat foreign invaders and debris in order to get rid of it. And so this virus will trick these cells into to ingesting it. And once they get inside the cell, then they get really happy and they start to multiply and grow. So it's a trick that happens that will eventually cause, like I said, the virus within the cell to grow, but that also kills the white blood cells so that the person.
My son,
oops,
Dion,
sorry.
he's going through
Sorry about
something.
that. Sorry. I had TV on pause, and so there you go. What was I saying? Oh, so yeah, the virus causes the it tricks the cell into ingesting it. The virus then gets inside the cell and starts to use all the machinery inside the cell to replicate itself. It goes crazy. It kills that cell. That cell, once the cell is dead, the cell bursts open. The virus particles can then get into the bloodstream and invade other cells, and the process continues on. And then it ends up killing a good number of the white blood cells, which is why the person who has HIV will have very few white blood cells, so that they cannot mount a reaction against a disease or a foreign invader, I should say, or anything actually. So what happens specifically? The virus, the HIV virus, is called a retrovirus. It uses reverse transcriptase. Remember, ACE, ASE means enzyme. And so what it does is it uses the RNA of the virus to then synthesize DNA, right? Instead of using DNA to create anything, it starts from RNA and creates DNA. This new DNA is then inserted into the host cell DNA, which means that it becomes a part of that person's genetic makeup now. And it may just sit there for a while. It might sit there for just a little while, and it might sit there for years. Dormant, meaning it's sleep, it's not doing anything. And then all of a sudden, one day, we don't know why, but then it's activated, it's triggered, it starts to work. It wakes up, and that causes the host cell to produce more virus RNA, more virus proteins. Capsid proteins are the proteins that make up the outer shell of the virus. Matrix protein is part of the inner workings of the virus. It tricks the cell, or it gets the cell to make those things. The cell then puts everything together. Now you have more viruses that, again, leave the cell and starts to infect other cells. This is the structure of HIV. So you can see it, look over it. If you have any questions, look it up. So the matrix is this on the inside. These are the RNA of the virus, so the genetic material of the virus. And then you have these reverse transcriptase. These are the enzymes, remember ASE, that help to replicate that genetic makeup. And that's how the HIV virus looks and functions. So some signs and symptoms of AIDS. The very first signs are flu-like symptoms. So the person feels like they have a flu. They have fever. They have chills. It's very non-specific, but then that will progress to night sweats. So the person will go to bed at night, and then they just cannot control how much they're sweating. Extreme fatigue, headaches, unexplained weight loss, lymphadenitis. Once they eventually go to the doctor tells them what's going on. They do some blood work. They can do a normal blood panel. There's one blood test, remember the CBC, complete blood count, where you look at how many red blood cells and white blood cells a person has. This person will have a very low white blood cell count. So the normal white blood cell count is 600 to 1200 cells per microliter of blood. But in AIDS, it's less than 200, which means that they have very few white blood cells to help them go through life. And this person is then becomes susceptible to those opportunistic infections. Remember, again, these are infections, viruses, bacteria that are already located within the body, but they don't cause problems because our immune system keeps them in check. This person doesn't have that, so it can cause problems. So some of the things that people will see when they have uncontrolled HIV or AIDS, they'll have candida or thrush. So have any of you ever noticed that there are like some children that will have like these fungal infections in their mouths with the white patches? That is thrush. Well, it's not uncommon in children, in babies, because babies don't have a strong immune system. Their immune system is developing. This is why we talked about it the other day. Their immune system, like the mom will lend the baby or give the baby some antibodies when the baby is ill, because baby has not the opportunity to actually produce its own. So in that case, this fungus, this fungus called candida, has an opportunity to thrive. And it looks like white patches on the mucosal membranes, more commonly seen in the mouth, but it's on the mucosal membranes. This is one of the telltale signs of a person who has an AIDS, that has AIDS, when it's not controlled by medications. There's also a condition called Kaposi sarcoma. OMA, O-M-A, is a tumor. So Kaposi sarcoma is a cancer that originates in the endothelial cells of the blood vessels. This causes purple spots on the person's skin. Now, again, what causes Kaposi sarcoma is something that's already inside of us. We don't normally get this because our immune systems can keep it in check, but in this person, the immune system cannot. So those spots on this guy's face are what the Kaposi sarcoma looks like when a person has AIDS and it is running rampant in the body. So AIDS is transmitted, HIV, the virus, is transmitted through bodily secretions, blood, semen, vaginal secretions, breast milk, or across the placenta. So again, remember that if you are near a person with HIV, you are not susceptible to getting HIV unless you are swapping body fluids with that person. Sweat does not seem to be a carrier. So if you shake a person's hand, you don't seem to be at risk of transmitting HIV to yourself. But if you are in a situation where you are working with blood, or you are intimate with somebody and you come in contact with their semen or their vaginal secretions, or when a HIV infected mother breastfeeds her child, those are ways that HIV can be transmitted from one person to another. The more common way of transmission is sexual intercourse. So this can be vaginal intercourse, anal intercourse, or even oral sex. So if someone is performing oral on somebody, they can potentially get HIV infection from oral sex. Contaminated blood products and contaminated needles. So those of you who are going into healthcare, this is why when you have your, when you learn about putting on all your protective equipment, this is why this is important, especially when you start learning how to do blood draws and IVs and things like that, or some of you who are going into surgery, you need to be careful of where the sharp metal object is at any time, because if you stick yourself with it, you could potentially transmit HIV to yourself. So again, it is not transmitted by casual contact. So if you lean on somebody, if you shake somebody's hand, if you touch somebody, that casual contact is not a way to transmit it. It has to be bodily fluids. If you're going to have intercourse with a person, using a latex condom seems to be an effective barrier, so that you are not going to be transmitted HIV if your partner happens to have HIV. Some strategies to combat it. First of all, prevent the binding of the proteins to the T cells. This is one of the ways that the medications work. One way is to disrupt reverse transcriptase. So that enzyme that takes the RNA and replicates it to create DNA, they try to disrupt that so that it's not able to create more viral RNA. These medications cannot eliminate HIV, but they can help, and those are a couple of ways that they do help, even though the medications do have serious side effects. HIV does develop drug resistance, so you may have seen commercials out here on TV. This is why they started to do medication combinations in conditions like HIV and others, but they do that because these viruses are very good at replicating. They're very good at evading our defenses, whether it is our own defenses or it is medications. Very good at evading those. So the pharmaceutical industry, medical industry is trying to find ways to trick the virus into not evading it and to actually being able to succumb to it and die, gotten rid of. So some of these medications are AZT, which was the first anti-HIV drug. This is the one that inhibits reverse transcriptase. You have your protease inhibitors. These inhibit enzymes that the HIV virus needs to replicate. And now there are many, many more HIV drugs on the market. So that is it for today. Let's talk about it in class.